Knock, knock, knock. Mr. Daniels, can I come in, please? Okay. How are you today? I'm Victoria. I understand you're going to be discharged today. I'm just going to hand sanitize my hand. And can you tell me your full name and your last four? Okay. So I understand you already have your bags packed, and the tech told me that she got your vital signs and she checked your blood glucose. I just have some discharge instructions I'd like to go over with you. So I know when you came in, you told the provider, that your doctor, that you was having some depression symptoms, and you came in with increased urination and hunger and thirst, and they diagnosed you with having diabetes, and you had a history of hypothyroidism and GERD. Is that correct? Okay. So I just want to go over some of the medications that the doctor ordered for you. And if you don't understand, please stop me at any time. And Mrs. Daniel, also, I would like to, for you to interrupt me if you have any questions or concerns about anything that I'm going through. Now, the medicine that you were currently on was Synthroid. I'm just going to go over that with you a little bit here. And the Synthroid is the trade name. The brand name is levothyroxine, and I have that all written down here for you. And what the treatment is, because you have a low thyroid problem, this medication doesn't cure it, but it's a hormone. It replaces the hormone balance. So it's important for you to take this medication the same time each day. And if you miss a dose, take the dose as soon as you can remember, unless it's almost time for the next dose. If you miss 2 to 3 doses, please contact your doctor. This medication does not cure your thyroid issue, like I said. It just is a supplement. So some of the side effects that you may have with this medication, if you at any time, if you're experiencing any chest pain, fast heartbeat, unusual sweating, diarrhea, vomiting, weight loss, and unable to tolerate heat, it is important that you let your doctor know. It's also important for you to know that the medication, you want to take 4 hours from any of the antacid, iron, or any kind of calcium medicine that you're taking. To get a better effect of it, you don't want to take it with any of these medicines. So you want to take it by itself. So it's kind of good, like if you wake up 6 o'clock in the morning, just take your medicine, this one medication, and then you can take your other medication 4 hours later. We also need to monitor your blood work. So we would like to draw your labs every 6 to 8 weeks. So you follow up with your primary doctor in 6 to 8 weeks while you're taking this medication, and the doctor will test your labs to see if they need to be adjusted, if you need to go higher or lower with your medicine. Too much medication may lead to an overdose and cause symptoms of chest pain, nervousness, insomnia, tremors, weight loss. And if this happens, the doctor may want to stop the dose for 2 to 6 days and restart at a lower dose. Do you have any questions? What about you, Mrs. Daniels? No? Okay. Next medication I want to go over is your pantoprazole. Is also, which is the brand name. The trade name is called Protonix. And you had a history of GERD, it's the gastroesophageal reflux disease. So you understand what that is, correct? The treatment is for the inflammation of the tube. When you eat, you have a tube that goes down to your stomach. That's called the esophagus. And sometimes the food or the acid will come back up. And so this medication suppresses the acid from coming up through your mouth, where you may experience like a sour taste in your mouth. this medication may take up to 4 weeks before you will feel any relief. It will help decrease the belly pain and heartburn. It is important for you to take this medication the entire time that the doctor prescribed it. It is important to avoid alcohol while you're taking this medication. Any medication that contains aspirin, any food that increases the irritation of your stomach, like fried food. I'm sure you guys might like fried chicken or spicy food. All of this will increase the irritation of your stomach, even greasy food. So you want to avoid all of this. It's important for you to report back to your doctor if you receive any black stool. So when you go to the bathroom and you have a bowel movement and you look at it and you notice it's black, or you're having diarrhea or severe stomach pain, you want to let your doctor know as soon as possible. Okay, you don't want to treat yourself with any type of anti-diarrhea medication. You want to let your doctor know so that he can give you the correct treatment. Some of the side effects of this medication, it can cause your blood sugar to go up. It also can cause in your blood your vitamin B12 deficiency or your bones to be weak. So we want to monitor this. If you have any headaches, you want to let the doctor know. Okay, another medication your doctor's putting you on is metoprolol. Okay, this medicine, the brand name is metoprolol and the trade name is Lopressa. You came in with your blood pressure really high, so this is to decrease your blood pressure. Since you've been here, your blood pressure been fine, and did your blood pressure and it was fine. So we just want you to take this medication same time each day. Also, do not skip it or double or miss dose. Take it as soon as you remember to take it. It may cause some drowsiness, so be cautious when you're driving, because this medicine, until your body get used to it, could feel a little dizzy. Change position slowly. You want to sit on the side of the bed for a couple minutes before you just get up. You want to notify the doctor if you're taking any herbal products, over-the-counter products, anything that could interfere with this. So let your doctor know any medication that you're taking. Their doctor is going to closely monitor your blood glucose with this medicine also, especially if weakness or irritability or you get extremely tired occur, then let your doctor know. Also, if you're feeling confused, depressed, you have a rash, fever, sore throat, unusual bleeding or bruising, let your doctor know. Just to let you know, to reinforce, this medication is to help with your blood pressure, so you want to take this every day. Some of the side effects, like I said, you could have a rash, you could have blurry vision, stuffy nose, constipation, diarrhea, nausea, vomiting. Also, I'm sorry, Mr. Daniel, but you could also have erectile dysfunction, decrease in sexual interest. You could be tired, weak, anxiety, dizziness. So if you feel like any of these problems are interfering with your daily life, just let the doctor know. He can make some adjustments. Any questions? Okay. Another medication to help with your blood pressure is lisinopril, the brand name Zestril. This medication, let's see here. This medication is also to help decrease your blood pressure. So you want to be careful when taking this. Again, you want to take this medication the same time every day. The doctor thinks the combination will help with your blood pressure. You want to avoid salt containing salt substitute containing potassium or food containing high levels of potassium. You're eating like you want to do more baked food, more grilled food. Um, Try to avoid as much fried food because all of this stuff could contribute to your high blood pressure. Again, change positions. When you're changing position, getting up, sit on the side of the bed for a couple minutes before you rise, because sudden increase in your blood pressure or decrease could happen when you get up really fast. It could cause you to be dizzy. So we would just want to encourage you to be careful. And also, the doctor is giving you a blood pressure machine, a prescription for a blood pressure machine to take home to help with this. So you won't have to, you can check your blood pressure periodically, just to make sure it's within the range that the doctor talked to you about. Metformin, when you came in, you were feeling the shape, the symptoms of thirsty. You wanted to drink a lot. You wanted you was having bad vision. You was urinating a lot. You were hungry. All of these symptoms are from diabetes. And the doctor prescribed you metformin. This is the treatment to manage your blood sugar. This medication will help keep it within a normal range. You should respond to the medication up to 4 weeks of taking it. Taking this medication with meals will help decrease the upsetting of your stomach. So, you know, before you have your breakfast, just take the pill and then eat your breakfast. Metformin is a brand name. The trade name for it is Glumesta, Glion, or Rymet. Um, you have to be careful that you don't miss a dose. Again, you want to take your medication as soon as possible. If you miss it, you want to follow up with your prescribed diet, your medication, exercise regimen is important. If you exercise 30 minutes at least 4 times a week, if you're feeling shaky, these are some signs of low blood sugar. You're feeling shaky, tremors, you know, you want to drink a glass of orange juice, you know, um, you can take 2 to 3 teaspoons of sugar, honey, or corn syrup dissolved in water, and your doctor's also giving you a glucometer machine, one of these little machines that we check your blood sugar every day before meals. You have a prescription for that also to take home to manage your blood sugar. And the doctor gave you the range of what it should be. And it on the machine will tell you if it's low and if it's high. So if it's low and you're feeling shaky, keep some juice, hard candy. And if it's high, more than normal, because you have to remember, it's important that I can't reiterate it enough that you have to take your medicine every day around the same time. So this medicine may cause you to have some diarrhea, and if it does, you want to let your doctor know. Always carry some forms of sugar packages or hard candy with you. You may have like a metallic taste that usually resolve, but in your mouth. And if you're having any treatments like a surgery, you want to let the doctor know. Also, if you have any, you could have side effects of diarrhea, nausea, vomiting, stomach pain, or fullness. You want to let your doctor know. Do either of you have any questions for me? Okay, this is just all of these papers will go with you, and you just sign here for me, Mr. Daniels. This is just saying that you understand everything that I said, and I'll just witness it for you. Is there anything I can do for you guys? Okay, so I'm going to call Escort up to have you transferred to the lobby. Is that okay? And Mrs. Daniel, you can go down and pick up bring the car to the front of the hospital. Yes, he's ready to go. Okay. Yep, and I see that you took everything out of your room. So it was nice meeting you all, and you all have a good day, okay? Thank you.